Bonjour tout le monde. Hey everyone. Today I'm doing an interview in English with a doctor that you might not be familiar with. He's also Canadian. His name is Dr. Steven Pelech. Thanks for being here today with me.
It's a
Good
real
morning.
pleasure, Eloise.
We're going to talk about, I wanted to, of course, I talked a lot about COVID during the last years. I think there's still a lot to be said. And before we get started, I want you to explain why you do have the expertise to talk about it. So you can introduce yourself.
Sure, thank you. Well, I'm a professor at the University of British Columbia, where I've been on faculty for about 35 years. And I'm also the founder of two biotech companies, Kinetech Pharmaceuticals. I was the CEO for 6 years, and then Connexus Bioinformatics Corporation, where I've been the president, chief scientific officer for, we're coming up to 25 years now. And I'm also the vice president and the co-chair of the Scientific and Medical Advisory Committee of the Canadian COVID Care Alliance. We recently renamed ourselves to the Canadian Citizens Care Alliance. But that group, which I chair, which is about 36 different scientists and professors from across the country, over the last 3 years, we've met by Zoom weekly and also by emails daily. And we go over the scientific literature as related to COVID-19. And through my company, Connexus Bioinformatics, we were also conducting a clinical study to look at the antibody response that people have, their immunity to the SARS-CoV-2 virus, and comparing this with natural immunity as opposed to vaccine-induced immunity. So I've been involved in about at least 25 court cases as an expert witness, testifying about natural immunity and any issues related to the vaccines that people have been taking. So that
Wow.
kind of gives you a background of my
You
expertise.
you
And
were also a witness on the National Citizen Inquiry.
that's correct, yes. I gave must have been about a little hour presentation going into a deep dive into
Mhm.
the issues related to COVID-19.
So, I feel like my first question I want to ask is how is it for you to speak against the narrative, being a professor at a university? How is it like for you in your work?
Well, I'm fortunate because I'm on the University of British Columbia Senate,
Hmm.
and I have a very strong track record of being a pretty solid scientist. I've published about 270 scientific papers in peer-reviewed journals, and I I try to focus on the facts, the science, and looking at the scientific literature to get a sense of what's actually been transpiring. And it's very distressing, actually, because when I've been trained as a scientist, we're always supposed to be searching for the truth and
Mhm.
recognizing that as you get more data, maybe you have to change your hypotheses. And what I've seen instead is that the science has been a little bit more like people investing in the stock market. When you invest in a company, you always have a very positive view of
Yeah.
how that company is going to perform, and that kind of greed. There's fear that there could be a problem, but there's this greed that you have a very rosy, optimistic view, and I think this is what happened with the COVID-19 vaccines. People really thought it was very important to have these vaccines as soon as possible to protect themselves against the disease.
Mhm.
And they kind of ignored a lot of the hypothetical problems. But then
Mhm.
once these problems actually manifested, they try to sweep it under the rug. And,
Yeah,
and
still
that
today.
narrative's continued even today. It's pretty amazing.
It's absolutely amazing, and that's what we're going to discuss. So there's this article that was published in the I think it's in Winnipeg, the Free Press,
Yes.
which I was not familiar with, and it's Bernard Massy that I received on my podcast, who actually put me in touch with you, Dr. Pelech,
Mhm.
and So you reply to this. This is called the Unwelcome Unvaxxed. If you guys want to look it up on Google, it's very easy to find, and you can read it. So I picked some parts of the article because the whole article is absolutely fascinating in so many ways. And so you replied, I think in 6 hours you had 154 pages reply. So we won't go through the whole
No.
document, but I
Yeah.
think there is a lot of things in there that need to be addressed. A lot of misinformation, a lot of stuff. So we're
Yeah.
gonna go through it. How did you react when you first read this article?
Well, there are been many articles in the past have been published in newspapers that have sort of blamed people who chose not to become vaccinated.
Oh
I'm
yeah,
one of those people. Um,
you say
about
it
10% of our
openly.
population decided not to get vaccinated.
Hmm.
And as it turns out, these vaccines did not perform
Yeah.
as we originally expected. And so blame had to be given to somebody for the increased amount of people getting COVID-19 after the introduction of the vaccines. And so the unvaccinated people were kind of singled out. I mean, they were the ones that had to do rapid antigen testing. They had the restrictions that were placed on them with the vax passports and the
They're
like,
not traveling in the
not
country.
traveling. Can't, and so as it turns out, that didn't really make any difference. Anybody who really understands the disease would recognize that actually the vaccine. I mean, the bottom line is the vaccines do not prevent you from getting infected. If you become infected, it does not reduce the transmissibility to people from a vaccinated person compared to an unvaccinated person.
Hmm.
And what's really disturbing is that it now appears that the more you're vaccinated with these booster shots, the more likely you will actually get COVID-19.
And that's a fact. We know that.
Yes, yes. In fact, the best data for this is from the Cleveland Clinic. In the summer of 2022, they tracked their staff, 51,000 people. Like this is about 200 hospitals in this network. And they tracked those 51,000 people based on their vaccination status at the beginning of the study for 6 months. And you can look at the data online, and it shows you that basically the people that were the least likely to get COVID during that 6 month period were the unvaccinated. And with each increase in vaccination, there was an increased occurrence of COVID-19. So the people that were vaccinated up to 5 times were the most likely to get COVID during that 6 month period. So that's just one study, but there's many other studies that kind of support the same
And
observation.
how could we explain that?
Well, it turns out that there's multiple mechanisms that are at play here, but three of them are key. One of them we called original antigenic sin. So what that means is that when you've been exposed to one variant of the virus and you develop an antibody response to it, even if that virus changes slightly in its genetic structure, and I should mention that the structures of the original Wuhan strain, the one that everyone first heard about this virus, and it's since evolved into alpha, beta, gamma, delta, and then Omicron, and
Hmm.
there's a whole bunch more now that are Omicron variants. They're all within 97% identical in their structures. So when you have an immune response, your immune response, even to the original Wuhan strain, is actually very effective against even the latest Omicron variants with the natural immunity. So what happens is because you've already kind of like primed your immune system with the early variant, when you get re-exposed to the virus, you tend to make the antibodies that you originally made against the first variant.
Hmm.
And so some of them, if there's some variation in the new variants, um, it may not give you as good an immune response. That's not really a problem, but this is one explanation. The second one is what we call antibody dependent enhancement. And so if you have a immune response that's there, but not quite as good because it's very focused on just one part of the virus rather than the whole virus, then what happens is you can have a situation where the virus, when the antibody sticks to the virus, it actually allows immune cells to, well, it allows the virus to attach to the immune cell. So instead of the immune cell attacking and destroying the virus, the virus can use this as a mechanism to attach to the immune cell, to get into the immune cell and kill the immune cell. So it is kind of backwards.
Right.
And so this antibody-dependent enhancement, this is well known for coronaviruses, SARS-CoV-1 original studies that were done with it 20 years ago. When they tried to develop vaccines, and it's like in ferrets, they found that actually those vaccines had antibody-dependent enhancement, which meant that those vaccinated ferrets all died when they were exposed to the virus, because the virus was more effective in killing off the immune system than the immune system was killing off the virus. And then the third mechanism is what we call tolerance. So when you're in an environment that might be seasonal, like pollen could be out there, some people develop allergic responses and they get hay fever. And the way to break that is to be constantly exposed to the allergen, and your body begins to recognize that this is not a threat. This is like your own body. Your immune system actually develops the ability to recognize self, so that you do not have an immune response against your own cells and the proteins in those cells. So when you have a vaccine where you're getting a delivery of genetic material that is used by your own body cells to produce a foreign protein, like the virus protein, spike protein of the SARS-CoV-2 virus, on your own cells in very, very high levels, your immune system begins to think that, wait a sec, this is happening on a regular basis. It's a huge amount. The level of spike protein that's produced by these vaccines is actually far greater than you would get from an actual virus infection.
Okay.
So you get a very good immune response, but your immune system begins to shift in its response to what we call tolerance, which means that basically your immune system will ignore that virus when you encounter it. So people who have natural immunity, in fact, most children that have been infected have no symptoms of COVID-19, about 70%. And we know that at least 40% of adults that are infected have no symptoms from the virus.
That's a lot.
Yes. And what happens is they still develop an immune response. And the next time they get it, it's even, again, unlikely, unless they're very down from stress or other disease conditions, it's unlikely they would get sick again. So that immunity protects them. And as you go out in the environment and the virus is there in waves, as we've seen at least 8 to 9 waves in the last 3.5 years, then what happens is you're constantly being boosted naturally against the virus. And that enhances the level of antibodies that you're producing to protect you while that virus is in the environment. But if that's called immune memory, we have memory B cells and T cells. The B cells produce the antibodies. The T cells, the attack cells that are infected with the virus. So the good news is that these antibodies can last for decades. Antibody producing cells and T cells. So you can have immune protection for probably the rest of your life.
Wow.
Now, the problem is that if you induce tolerance, then what you're doing actually is killing off those particular B cells and T cells that specifically recognize the virus. And so as you kill them off, you won't have an immune response that's as effective.
So that's
Your
when we
virus
say that it
active.
affects our immune system.
That's right. So this is why people with more and more booster shots actually further and further depress their immune system. They have an
Right.
initial response that gets shorter and shorter in its protection period, but ultimately you end up with a situation where these individuals have lost their immune response to the
Right.
virus,
I understand.
especially the spike protein, which is the protein that sticks out on the surface of the virus, which is one of the best parts of the virus for the immune system to attack.
Well, that makes sense, and I observe it around me. For
Oh
those
yeah,
who had a lot of injections, they are very sick, but we're not allowed to ask any questions or say anything. So you already answered a lot of stuff that was addressed in the Unwelcome Unvaxxed that was published. But I'm gonna start my reading, and then we can just go in depth. So
sure.
I'm going. If you asked me, okay, so I skipped the intro because it was long, but for those of you who want to read it, it's called The Unwelcome Unvaxxed, and it was published in the Winnipeg Free Press. And the person who wrote it, her name is Patricia Dawn Robertson. So she says, if you asked me in March 2020 if I'd still be COVID vigilant in January 2024, I'd have scoffed. By 2024, I imagine optimistically the scientists would have an effective vaccine and we would have beat this thing together as a community of caring, concerned citizens. Yet in my age group, 59 to 69, only 27% of Canadians have their booster shots up to date. After almost 4 years on the pandemic front lines, medical staff are burnt out, yet many yahoos can be bothered to get a vaccine booster. Unboosted is unvaccinated. Okay, so that's the first part. I want you to comment.
Well, the problem has been that the most likely individuals to have acquired natural immunity early on were actually healthcare workers.
Mm,
And we were involved in a study with the Women's and Children's Hospital in Vancouver that also involved the BC Center for Disease Control. And we had developed this test for determining whether a person has antibodies against the SARS-CoV-2 virus. And we applied that test to samples of blood samples from about 276 healthy adults, of which maybe only 4 or 5 of them had reported any symptoms of COVID-19. And we found that, and when we tested them, this was in basically May 15th, roughly, to June 15th of 2020. So
okay.
nobody had any antibodies at that point from
Hmm.
a vaccine. They had to be
Hmm.
from infection. And 90% of those individuals all had antibodies against the SARS-CoV-2 virus. And half of those individuals were healthcare workers.
Hmm.
So we know probably in the Vancouver area that this virus, from our own study, we've tested about 4,500 people now. And interestingly, of those people, about 1,600 of them reported having symptoms of COVID-19. Now, we didn't have tests available until later in the spring of 2020, the PCR test to confirm that it was actually that virus.
Hmm.
But if I look at those 1,600 people that had COVID-19 like symptoms, which we can confirm by our antibody testing in their blood samples, all had antibodies against the virus. So I think it's fair to say they were infected.
Hmm.
Their sickness was 3/4 of those individuals was between November and December of 2019 and January and February and March of 2020. So although the pandemic officially started in areas like
March.
Vancouver in March,
Hmm.
the virus was already spreading around in our population really for about 4 months before that. And
Well.
we know that even in China in October,
Hmm.
there are reports of Wuhan where the city was basically shut down from sickness. So they had military games going on. So we had, for example, in these military games, a third of the Canadian participants in those, and many other countries as well, came back sick, very sick,
Mm.
from Wuhan. So that may have been one of the major events to first introduce the virus into Canada. And as more samples have been tested from that period, we have lots of evidence that the virus was around at that time.
Hmm.
Now, what's happened is because of the PCR testing, we think that the virus, because now we can sequence the genome of the entire virus. It encodes about 28 different proteins, and so we can have the amino acid sequence of the proteins encoded by the 28 genes, and we have the gene sequences as well. And so what was observed is as we started to sequence the genome, it looked like the virus has actually come from Europe rather than from China.
Hmm.
But we now know that you can have a situation where, for example, in 2021, in November, the predominant variant was the Delta variant.
Hmm.
And in the space of a month, that variant was displaced with a new variant, which was the first of the Omicron variants.
Hmm.
So we can see even within a month, you can have a dramatic shift
Right.
in the predominating SARS-CoV-2 virus.
Hmm.
So what's happened is we know of situations like SARS-CoV-1 that was a pandemic 20 years ago, that you can have the virus infect the community, and without any vaccines, without any special drugs that target that virus, it disappeared.
Mm.
Now this is a bit of a mystery. How can you have a coronavirus that is very, very similar in structure to SARS-CoV-2, although the most similar structure is a bat coronavirus, which, by the way, is about 97% identical to SARS-CoV-2.
Hmm.
But SARS-CoV-2 has sequences, portions that are very similar to SARS-CoV-1, and some other sequences that are in other coronaviruses, but not in SARS-CoV-1 or MERS, which was another coronavirus that caused disease about 10 years ago. So the point here is that it does look as though SARS-CoV-2 was genetically engineered.
Right. We don't have an absolute proof of that yet.
I think pretty much anybody who's really looked at this in any kind of depth is pretty much convinced now it was a genetically engineered virus. As apart from some of the differences, there are telltale signs in the genetic structure of what we call restriction endonuclease sites. These are sites that genetic engineers use to kind of shuffle portions of genes around and introduce new parts to those genes. So, I mean, it's got all the telltale signs, and there's lots of documentation for funding from the National Institutes of Health, in fact, in the US, giving money to the Wuhan Institute with grants that are describing doing this genetic engineering in the first place. So I think I think probably 95% of people who really study this now are convinced it was a genetically engineered virus. It was based on the original bat virus that was discovered maybe 12 years before the pandemic started, but it's been tinkered. So anyways, the key point here is that we had SARS-CoV-1. It was actually much more deadly than SARS-CoV-2, and it disappeared. You had about 147 or so people that actually died in Canada. That was it. And so what happened? And I think what's happened is that this virus undergoes mutation rates very quickly. And in order for a virus to be successful, it has to infect a lot of people very easily. And secondly, it can't hurt those people. That is, the people would not be aware that they're infected. So they will go out and do their normal business and interact with people and spread that virus to another person.
So
So
even asymptomatic people can be spreaders.
it's possible, but
Hmm.
they're less likely because in order uh, to release the virus, our body responds when we're sick to
Hmm.
coughing and postnasal drip and all these things to expel the virus.
Hmm.
So a person who's really sick is going to be spreading a lot more of the virus out there than a person who's asymptomatic. So there, it's possible for an asymptomatic person, a person who has no symptoms,
Hmm.
to spread the virus, but the bulk of that viral spread is going to come from people who are actively sick. And
Hmm.
this has been well documented in studies within families where, interestingly, in a household in China, we could tell even in the first few months of the pandemic that only about 18% of the people in the household actually got sick. So, and they were starting to do the PCR tests at that time, so we could tell if they were in fact actually infected at the time.
Hmm.
So, asymptomatic people, um, they rarely are going to be the major sources of the spread of the virus.
Fauci said that very early in the COVID crisis, but then he changed his mind, and the video was still circulating online. But at the end of the day, that's the truth.
Well, I think what happened is a lot of us in the scientific community um, relied on early data that we had with coronaviruses and
Hmm.
also influenza virus and the respiratory syncytial virus (RSV),
Hmm.
which are infectious viruses that come in through the airways, and they're respiratory illnesses. And so these viruses are very similar in their properties, size wise, and even being RNA viruses. In the case of influenza and SARS-CoV-2, they're almost the same size virus. They're both RNA viruses. Uh,
Hmm.
so we know a lot about influenza, you know,
Right.
and as it turns out, we knew even that the masks don't work with influenza.
There's
And
still a debate around that. Like, so, some people will say that masks still work. Well, and I'll get to that in the text. But what do you think about the mask?
well,
It's
I've written a 47-page review going through hundreds of scientific papers on the effectiveness of these masks. And actually, the data really doesn't support it. I mean, didn't think the masks worked originally. Uh, I know Bonnie Henry here in British Columbia, who's our chief medical doctor, argued that they didn't work because she knew the scientific literature. They all turned around and said that these are very effective. But when you start to look at the actual clinical studies that have been done on the effectiveness of these masks, and this was all of these studies were um, critically analyzed in what we call meta reviews. This is where you take many scientific papers and you combine the data.
hmm.
And there's a Cochrane study, which is sort of one of um, the groups that actually do the most rigorous analysis with meta analyses. They concluded, and this was published about a year ago, that these masks there's no real benefit, like N95s, surgical masks, cloth masks.
Doesn't make a
There is
difference.
no data to support that these are actually effective.
Okay, so for those of you who are still driving your car alone with a mask on your face, you just you can't
No,
breathe for nothing, basically.
no, well, it actually comes at a cost because there
Hmm.
are issues for people that are wearing masks, especially they're very active. What
Hmm.
happens is, like in the air, the concentration of oxygen is about 21%. Now, and by the way, some people say, well, they wear surgical masks, and these people are working for hours
Hmm.
in a surgical suite,
Right.
but the concentration of oxygen in those suites is 23.5% typically.
So it's
They have very,
controlled.
very high levels of oxygen to compensate
Mm.
for the obstruction that the masks do. If they went any higher, then the surgical suite could catch fire, because the more oxygen you have, the
Mm.
more likely that you can have a fire.
Mm-hmm.
So, but these typically, with 21% oxygen in our atmosphere, the concentration of carbon dioxide is 0.04% of what's in the atmosphere. So when you breathe in oxygen, that oxygen is used along with the food you eat, like sugars,
Mm-hmm.
to make basically energy for your body.
Yeah.
And in doing so, it produces carbon dioxide. So
Mm-hmm.
when you breathe out about 16% oxygen and 5% carbon
Carbon.
dioxide. So when you have that mask on, even though gases can go through the mask, you still have air currents that happen and obstruction.
Mm-hmm.
So you rebreathe the air that you expired along with the air that's coming in also through the mask.
That explains the headaches that we all have
That's
when
right.
we.
So you end up with lower oxygen in your blood, higher carbon dioxide in your blood,
Mm-hmm.
and that'll give you brain fog. And so when you have children that are in school and they're wearing masks all the time, and children have a higher metabolic rate than adults do, they need to breathe more oxygen.
Mm-hmm.
So what ends up happening is their learning is compromised.
Right.
And then people who wear masks, like if you have a beard, the
Right.
masks don't work. If
Ah.
you when you put them on and you if you were coughing or something like that, then it has to go somewhere. So it actually
Mhm.
goes behind you. So
Mm.
when you're in a mask and you turn away from somebody, you're
You,
actually
you aim
redirecting
in the different direction,
it
basically.
to the person behind you.
Nice.
So
So
there's
there's
that, but there's
that.
also acne problems, there's skin
Yeah.
problems, there's collection of bacteria.
Yeah.
It actually it causes probably more harm than good by
And
wearing the mask.
you didn't even mention all the young children that are learning to speak that that can see
That's
the
right.
mouth, and I
That's
had
right.
young babies during the past years, so that was a big concern to me. And it's been also studied that the kids who couldn't see the mouth would have problem learning a language. So there's a lot.
The psychological issues that are great, and those have been well studied too. And there's increased anxiety in people
Mm,
when they're around people with masks, and and that increased anxiety causes depression,
hmm.
and that reduces your immune system.
Yeah, so it's just a big circle.
Exactly, just reinforces this, and it just gets worse. So this is a of concern. I think there are situations where masks do make a difference, like especially for bacterial type infections. Bacteria are about 10 times larger. But if you were
Oh.
to look at the size of the virus versus the size of the pores in the mask, it's the equivalent of using a chain link fence to keep out mosquitoes. It just does not work.
It doesn't even if you want really hard, it's not gonna work. I'm gonna go on with the reading of the article, and thanks for the mass. People are really appreciating in the comments. So it goes on. Others reject the concept of vaccination entirely and stoke fear via conspiracy theories. I'm not done with that, but only the word theory here annoys me because there's a lot of substance and facts now, but everything goes in the big bag of conspiracy
There's
theories.
about 6 months delay between a theory becoming a fact.
And yeah, well, we'll keep going, but there's so much to say. A belligerent branch of my extended family remains unvaccinated. The rationale: the concerned mother of three needs to know what's in the vaccines. The 30-something urbanite is a rebellious millennial who demands full disclosure. But this isn't a cereal box on the breakfast table. It's a vaccine. The ingredients are patented, tested, and approved by Health Canada. So they must be safe and
There's a lot
effective.
to pack in there.
Yes.
Actually, I I get vaccinated for flu. I mean, I think vaccines in general are pretty effective, and they've been useful, although there has been a lot of data that shows that many of the reductions in these diseases that plagued humanity were already on the way down before the vaccines are really started to be introduced. But there are situations where I think clearly the vaccines can be very effective. I'm not so sure that a young child, a baby, needs to be vaccinated. Some of these kids are getting up to 80 or more
No,
vaccines.
that's way too much.
Yeah, and I think that's probably not appropriate
Right.
because your immune system is learning to recognize viruses and bacteria that are out there, and fungi.
Hmm.
But but there's a big difference people have to understand between the vaccines that were approved in Canada, which were basically pretty much until Medicago came along, and Novavax. These were more traditional type vaccines.
Hmm.
But the ones that most people got, we call these genetic vaccines.
But it never got on the market anyway. So,
That's right. No, this
mhm.
was a big, this is big scandalous. I mean,
Right.
hundreds of millions of dollars were spent
In Quebec.
in Quebec
Hmm.
to produce the plants. There was not a single delivery of a
Exactly.
vaccine to Canadians.
And they just voted that they won't disclose why. So there's just nothing to be said.
Yeah.
We just turn the page and keep going.
Well, I think the big problem was that the vaccine was done using tobacco leaves, and the World Health Organization would not support anything that would encourage the use of
Tobacco.
So they were
Okay.
doomed from the start.
Right.
But the
I
thing is,
interrupted you. Sorry. That was
no,
just the little parenthesis.
yeah, no, but it's a good point. Uh, with the, I mean, if people understood exactly the process, they'd be astounded. So let me illuminate people on this. So first of all, we have two types of these genetic vaccines. One is they use lipid nanoparticles, basically little fat bags that have the genetic material to make the spike protein of the SARS-CoV-2 virus, or they have the genetic material in an adenovirus that's been engineered that when this virus is like a delivery system, it just gets that genetic material into a cell, but it doesn't replicate. The virus can't duplicate. So it's a fairly safe virus. Now, the thing is, in both scenarios, so you have the Pfizer vaccine and the Moderna vaccine, which are the ones that use the lipid nanoparticles, and you have the AstraZeneca vaccine and the Johnson & Johnson vaccine, or Janssen vaccine, which uses the adenovirus particles. Now, the adenovirus particles can only be used once or twice because after you've used them and your body makes an immune response to the virus, then the next time that you get infected, or so you're injected with the virus in the vaccine, your immune system destroys the virus before it can actually get inside cells. So you're stuck with booster shots. Pretty much have to be from these lipid nanoparticles that contain the RNA, this genetic material to make the spike protein. So what most people don't understand is that when you get those vaccines, you're injecting into your deltoid muscles in your arm, typically about tens of trillions of lipid nanoparticles. Imagine the lipid nanoparticles pretty much like a virus. So you're injecting tens of trillions of copies. Now, if you have a traditional vaccine and you're injecting what is usually a weakened form of the virus, or it's been heat killed, what happens is you're getting maybe 50 to a few thousand copies of that virus, not tens of trillions.
Wow.
Of lipid nanoparticles.
Not even close.
Now, when you have a virus, you have one copy of the gene that is going to be used to make the viral protein. But in the lipid nanoparticles, you have 5 to 10 copies of the gene. Now, the gene has been modified chemically so that it has a non-natural component that makes that RNA more stable. So the RNA is like a blueprint to make the spike protein. and you're making that blueprint more stable in the body so that you can make more copies from a single copy of the gene. You can make hundreds of copies of the protein from that. And those proteins are going to be produced inside the cell, but exported to the surface of the cell. So your body, your immune system, sees these cells that have a foreign protein on their surface. And so the normal response will be an immune attack against those cells.
Mm-hmm.
And in order to eventually develop stimulated T cells and B cells that produce antibodies, you have to attack the cells that are producing the spike protein and produce little pieces of those cells, obviously damaging or even destroying those cells, that can be engulfed, eaten up by what we call antigen presenting cells that will then stimulate the T cells and the B cells in the lymph nodes. Now, that by itself is problematic, but what's even more problematic is that those lipid nanoparticles that are injected in your arm, we know from studies that are done in rats and mice, that they travel throughout your entire body. And within 2 days of injection, 76% at least of those lipid nanoparticles are everywhere in your brain. The most concentrated is the liver, the spleen, the adrenals, the ovaries.
Mm-hmm.
They're very high concentrations. And of course, that means that, and we know from immunohistochemistry studies where we can visualize where the spike protein is in tissue slices from people who have died following vaccination, that this is in their brain, this is in their heart, this is
The heart a lot.
The entire body. This explains for myocarditis.
Right.
If you're a male and you're between ages 12 to 29, your chances of getting symptomatic myocarditis, this is where you can be fainting, could even die.
Mm-hmm.
It's actually about 1 in 2,000
That's a lot.
for males between, like, say, 12 and 29. With the Moderna vaccine, but 1 in 5,000 with the Pfizer vaccine. Now, that's bad. That's very
bad. Yeah. Knowing how many people are vaccinated.
Where they follow people who've had vaccine-induced myocarditis, the lethality rate is about 4.5% in the first year. And we know with other myocarditis that the risk continues. So typically after 6 years with myocarditis, the rate of death is about 20%. So now...
Wait, just to understand. So you mean that if you had asymptomatic myocarditis, it will follow you for all your life and you might die from it? Is that what I understand?
That's right. And the reason is this. Myocarditis is where your immune cells are infiltrating your heart muscle. It's either the inside heart muscle or the outside of the heart has a muscle. That's the pericardium.
Yeah.
So you can have myopericarditis or you can have myocarditis. And so what's happening is the immune cells are attacking the muscle cells and they're killing the muscle cells. Now, there may be some cases damage and you can get some recovery. And I think this is what a lot of people were hoping was the case with myocarditis. But in reality, what happens is that those cells are killed. They're not replaced by new muscle cells. They're replaced by scar tissue. When you have death of neurons or you have death of these cardiomyocytes, these heart muscle cells, then what happens is they can't divide and have replacement of exactly the same cells. You have other cells that replace it. In the case of the heart, it's scar tissue. So the surviving muscle cells have to get bigger. Now, when you exercise, your muscles get bigger. Well, you're not getting more muscle cells. The existing muscle cells are actually getting larger. So this is what happens in your heart. These surviving muscle cells get larger to compensate for the need to pump that blood through your body, and the heart gets bigger. And as the heart gets bigger, there's more chances of actually causing arteriosclerosis from the high blood pressure when you're really exerting yourself. But in the case of myocarditis, if you have damage in certain parts of the heart, you can get what's called arrhythmia of the heart. So instead of the chambers of the heart beating in unison to pump the blood through, they can be pumping against each other. And so the blood doesn't go. And that's why a person will faint, because they're not getting the oxygen. That happens. Now, for every case of symptomatic myocarditis, you may have about 3 cases of asymptomatic myocarditis. So what that means
is dangerous.
The damage, but they haven't had an episode to be aware that they've had damage. So there was a study done in Bangkok a few years ago now, where they followed children that were 13 to, I think it was 18 years of age. There was about 301 children in the study. 201 of them were males and 100 were females. And they found that 29% of those children had heart issues after they were vaccinated with the Pfizer vaccine. And of those...
When was this study? Was it recent?
This was about 1.5 years ago.
Okay.
Right. So this has actually been around for a while. A lot of people know about the study. It's published in a peer-reviewed scientific journal. So what you find in that study, 7 of those children had myocarditis. You can detect it by imaging of the heart or the measurement of blood proteins like troponin, which is produced in the heart, which is not normally in your blood unless your heart's damaged. And so they found that 7 of those 201 males actually had myocarditis or pericarditis. Most of them were actually myopericarditis. But that works out to 1 in 29.
That's a lot.
Had asymptomatic myocarditis.
And we're still injecting kids.
Yes, even 6-month-old babies. Now, what's happened is around the world, this data is out there. So health officials in other countries have actually no longer recommend vaccination of children. In fact, some countries don't even recommend vaccination of adults.
Well, Florida, well, it's not a country,
Florida's
but it's a
one,
state.
but the Sweden, Norway, Denmark, Australia.
Australia? I didn't know that they've been very, very far.
Vaccination of children.
Wow.
And the list just goes on.
But not here.
But not here. We're actually one of the most highly vaccinated populations in the world.
That's worrisome.
It is, and the data is showing that first of all, there's no correlation between the rate of vaccination and the rate of COVID-19. You would expect that if you had more vaccinated, you'd have less COVID-19. There's no relationship at all. But the other problem is that we're seeing that there's an increase since the introduction of the vaccine. So not in the first year of the pandemic, when this virus was unchecked by any vaccines, but with the introduction of the vaccines, we see an increase in all-cause mortality in Canada and actually in many other countries around the world.
Where they vaccinated a lot.
10 to 15% increases in death.
You said 10 to 15? 10 to 15%?
Yes.
That's pretty intense.
Yes. Now it's starting to go down a little bit as the vaccines are less taken up by people.
Right.
So we have a correlation between this occurring when the vaccines come, and as the vaccines are no longer being used, we're seeing it decline. So that's a pretty good correlation. I mean, when you look at the data in vaccine injury databases, like the VAERS system in the United States, or the VIGI-Access system, which is with the World Health Organization, or Eurovigilance with the European Medicines Agency, these are all databases where doctors generally, but sometimes individuals, can report injuries in response to vaccines. Now, if you take all of the 30 years of data in the VAERS system, and there's about 80 different vaccines that are covered there, there are more reports of injuries and deaths with the COVID-19 vaccines than all of the other vaccines put together for the last 30 years. So we know also with Pfizer's own data, so after they market it, their vaccine, they have to take these reports and provide the reports back to the government. And so these reports finally were revealed to the general public after a judge in the US ruled that they had to release these documents.
Because they wanted them concealed for 75 years, I believe.
That's the one.
Yeah, that's the one.
That's the one. So they give them 8 months to do it. And
That's better.
There's tens of thousands of documents that have gone through the people of finding all these things. So we know these vaccines, we know how they could cause injury.
Yeah.
Explain. We know they do cause injury because the databases show us that.
And we still inject them.
It's not preventing people from getting COVID-19. In fact, it's increasing their chances of getting COVID-19.
We just answered Diane's question, but I wanted to put that on the screen. She lost her best friend after just one injection. So yeah. I'm very sorry for your loss. And I know a lot of people are in this situation where it's very hard to make the direct connection. Some doctors won't do it.
Yeah, well, there's a problem here in that, first of all, I explained how it is that people can lose their immunity to the virus with repeated vaccine injections. Mm-hmm. There's also the other side of the equation, which is when you are in a pandemic and the virus is in the environment and you go and get vaccinated, the first week and a half, you're more likely to get infected by the virus right after you're vaccinated. The reason for this is that imagine that you've just been vaccinated. These lipid nanoparticles have traveled throughout your body. As a result, you're producing all this spike protein on the surface of your cells. Now, during that period, you get infected with the virus. It comes in through your nose and mouth. Well, what happens is your immune system is very mobile. So it goes to where the action seems to be. And the action is primarily in the rest of your body, not in your nose and the airways and passages. So that gives an opportunity for the virus to replicate. And being at that point where it can be, again, released back into the environment, a person who's just been vaccinated, while the virus is out there in the environment, is more likely to actually transmit that virus to somebody else than an unvaccinated person. Now, an unvaccinated person, if you've been vaccinated and you get COVID-19 during that first 2 weeks or even 3 weeks in British Columbia, we considered you unvaccinated.
Unvaxxed. Mm-hmm.
So the data from those people is mixed in with the data for people who are truly unvaccinated.
So that becomes very hard to know what's the truth.
Right. So there is studies that have been done, and the best is out of the United Kingdom. They published this about maybe 8-9 months ago. And there we can follow the vaccination status of a person and the likelihood that they were developing COVID, and also linked to all-cause mortality. And what we can see is that as you are more vaccinated, your chances of dying from all causes is higher, and also getting COVID-19 is higher from that data. So this is very much like the Cleveland Clinic data that I told you about earlier, but This is really well quantified. Mm-hmm. So in Alberta Health, they actually tracked for people who had been vaccinated and they got COVID-19 again, when did they most likely get COVID-19? And what that data showed very, very clearly is that in the first day after vaccination, your risk goes up a little bit. Mm-hmm. And then the second day, it goes even higher. And then third and fourth and fifth and sixth days to the ninth day, the risk increases that you get COVID-19, and then it peaks for a couple of days, and then it drops down. And it drops down because by that point, you're starting to produce a strong immune response. It's going to be protective. But that first, 10 days, you're actually increasing your risk of getting COVID-19.
And that's why we know so many people who got injected and then got COVID. That's
That's
just
right.
classic scenario.
And they're all mixed again with the unvaccinated. And now, for
Right.
people that have been already exposed to the virus, they already have a strong immune response. Okay. So the first time that an individual gets vaccinated now, they're producing these spike proteins on the surface of their cells, and they have a strong immune response from the natural infection they had earlier. Now they're getting a very strong inflammatory attacks on their own cells. Much more damage to those tissues than had they never been exposed to the virus before and developed natural immunity. Of course, that immunity, that attack will get even stronger and stronger as you get more and more boosting to attack your own cells. And the problem with these vaccines is that, first, I didn't even talk about the contamination in these vaccines that we've learned about. It turns out that they have DNA in there. The DNA was used to make the RNA that was during the manufacturing of the virus, but the DNA, if it gets incorporated into your cells, and there's
we know it
billions
does.
of copies of the DNA that are in each inoculation, along with the trillions of copies of the RNA. But you can keep making the RNA if you're taking up that DNA plasmid in your cells, and
your ovaries.
In your ovaries, and it'll continue to produce more RNA from the DNA, and from the RNA you make the protein. So you can do that indefinitely.
And pass that to your children. If
probably not.
No, I had different perspective on that on my podcast.
Well, first of all, if you have cells that have taken up the vaccine, you can have some of the DNA in there, right? But you're going to have a lot of the RNA. And the RNA is going to be producing the spike protein on the surface of those cells. So what you're going to pass on to your children is basically going to be from an infected egg, infected with the vaccine. Well, those eggs are going to be attacked by the immune system and taken out.
So they're not
going
likely
to get
to
fertilized,
be picked.
and you're not going to have a baby. That's very, very unlikely.
Very unlikely.
Yeah. So
but that's still a possibility, but I see what you mean.
Yeah. But the problem is, look, when you're a young baby girl, you're born with all of the oocytes that you're going to have for the rest of your life.
Yeah.
And so what happens is when you get through puberty and now woman starts to have their periods, well, with each period, you're having the conversion of one of those oocytes into a fertilizable egg. Sometimes with twins, you have two of them, right? So, but a woman will have about 400 periods in her life. Her periods end when she runs out of oocytes. And you may start with tens of thousands of oocytes in the baby, but most of those oocytes will die off over time. And so the concern I have is that, well, if you have an immune attack against the ovaries, and we already know that there's something fishy going on here, because about 40% of women that are vaccinated have issues with their
periods,
menstrual periods, right? And so this is controlled, your periods, by your pituitary gland in your brain, hypothalamus, and your ovaries. They produce hormones that basically regulate the period.
Right.
And so that the fact that those are disturbed indicates that there is effects probably on the ovaries. And if you have an inflammatory attack against the ovaries, you could have damage to the oocytes.
Right.
You could have a scenario where basically women will go into menopause much earlier in life.
Right.
These are hypothetical risks. I hope that I'm wrong about this,
Mhm.
But everything tells me that for a number of women, this is going to be a major issue in the future.
And that brings me back to this article. So for those who just joined us, we are replying to an article that was published in the Winnipeg Free Press. It's an opinion, and we were just reacting to the fact that she is mad at someone in her family who's a mother who didn't want to get her children vaccinated because she wants to know what's in the vaccine. I am a mother of two very young kids, and I don't know how it's possible to blame a mother for wanting to protect her children. I don't know what's wrong with our society, but I think that a mother who's protecting her kids should just be honored and, applaud, nothing else. So that was just my opinion about that. I'll keep going with the.
Well, I
Is there?
think I would like to, Eloise, bring out firstly that you always use the principle of precaution when you're
Mm-hmm.
dealing with, especially pregnant women and
Yeah.
young babies. You don't do experimental therapies. Now, you brought up earlier about, well, this is Health Canada approved. People need to understand what was that approval process.
Yeah,
And
they need to go ahead.
yeah, the Canadian government basically negotiated in the summer of 2020 with 7 different manufacturers of vaccines before they even had a product to secure enough vaccine doses to inoculate the entire population with 7 shots per person. And then since then, it would actually increase to 10 shots per person. Now, as it turns out, that was done in the summer. And it wasn't until the end of November that Health Canada approved the use of these vaccines for people with an interim order. Now, an interim order, you do not have to demonstrate that the product is safe, and you do not have to demonstrate that the product is effective.
But they kept repeating it's safe and effective, so it must be true.
Well, no, you do not require that with an interim order. You have to look at the balance of information that's available versus what's perceived to be the threat,
Mm,
and then you make a decision based on that. So the
mm,
clinical data that was available to Health Canada to make their decision was only 2 months of studies where they had injected people. Let's say the Pfizer study had about around 40,000 people in it, and about 20,000 roughly were vaccinated with the COVID-19 vaccine, and you had about 20,000 placebo. And in that study, it was the first 2 months of that study, the data that they used. And they used what's called relative risk reduction versus absolute risk reduction.
mm.
So, relative risk reduction is really based on the idea that in your study, out of the number of people that were in the study, how many of them got infected in the vaccinated group versus the unvaccinated group. And so this is where they get these numbers of 95% reduction. However, the number of people who actually infected in both groups compared to the number of people that were tracked over 6 months ultimately is only like barely a percent. So the actual risk reduction worked out to 0.8% of the population that was in the study by being vaccinated versus being unvaccinated. So what does that mean? It means that if you vaccinate, like, let's say, the entire population of the country, during that 6 month period of time, you would have only reduced the occurrence of the COVID infection by 0.8%. The other people most of them would just never gotten infected in the first place, or if they did, they'd had no symptoms.
Yeah.
But more people died in the vaccinated group in that 6 month study. More people that were vaccinated than unvaccinated. The risk of having a severe injury that required hospitalization in the vaccinated group was about 5%.
Hmm.
And about 70% of them had symptoms that affected them, at least, we call them mild, but, they couldn't go to work or they couldn't do things for a day or two. So when you compare that to the number of people that get COVID and have
Hmm.
no symptoms at
Yeah.
all.
And
You're
still
actually
function.
more likely to be ill
Yeah.
from the uh, the vaccine than you are from actually the virus. This is the absurdity of it. Now,
There's a lot of absurdities, but that's one of them.
yes. So, but anyways, the key point here is that we did not know, Health Canada did not know,
Hmm.
for example, that there was SV40
Hmm.
uh,
Now they do.
in the plasmids that were used to make the RNA that goes in the vaccine, and these plasmids are contaminating the vaccines.
Hmm.
It was not disclosed by
Yeah.
Pfizer. A lot of data was not disclosed. We have more data that there could be endotoxin from. In fact, this is what's really fascinating. The original material that was used for the clinical trials was done by what we call process one, which is a different method that's much more clean, less likely to have issues
Hmm.
um, than the process two, which is how they scaled up the production of the vaccine to make it for mass production. It's a completely different process,
Yeah.
and it introduces, like the DNA plasmid that mentioned earlier was not in process one.
Hmm.
And there is a lot of variability from batch to batch as they start to track the reports in the VAERS system and other systems for vaccine injury. Different batches of the vaccine had very different rates
Hmm.
of vaccine reported injury. So this is the problem. We don't actually have proper testing
And I discussed
of
this.
the mass produced batches that most people got.
And I discussed for those who barely or understand English but are more comfortable in French. What you just said, I discussed this with Dr. Patrick Provost, Bernard Massy, and Alexandra Henrion-Code. So these are topics that I went in depth in different interviews. So very interesting. There's so much to say, and I see the time, and I want to. There are other points I wanted to address in her article, so I'm going to read a little bit more of it and give you the reply after give you the mic. So she says, just for those who just joined, her name is Patricia Dawn Robertson, and we are just replying to her. It was published in the Winnipeg Free Press. So, what she says to those who don't want to get vaccinated is it's not just about you. The complete lack of concern for other is repugnant. We don't just vaccinate to for self protection, but to protect the vulnerable. The refusal to vax is selfish, it's reckless, and it's burdening our overtaxed healthcare system as if that is our personal problem. And she goes on, I'm here to call out the unvaccinated. It's been 4 years. I'm tired of nodding my head patiently while they spout misinformation and ignorant rationales. I now equate the two: unvaccinated equals COVID carrier. There's a
Yeah,
lot in
well,
there
it's
too.
complete. Unfortunately, she's just not that well informed, and
She's been
the health
published.
professionals have, agencies have been actually the major spreaders of misinformation.
Yeah.
Unfortunately, it's very. I mean, I've been involved in this in drug development, and my company we've made about 1,600 different antibodies against cancer proteins and proteins involved in neurological disorders to help facilitate research in the area. So I'm really familiar with all this kind of area, and I've exemplified that with some of our discussion. I think the reality is that these vaccines, the technology, the RNA technology with these lipid nanoparticles is dangerous.
Hmm.
This does not just apply to COVID-19. And there are literally hundreds of new vaccines that are under development right now
Hmm.
using this newer technology.
Which is the most alarming part, I believe.
Yes, because this is never, first of all, these RNA vaccines have never been used before in any studies for any other disease. This is the first time. and it's been largely tested. Um, Normally, when you have a vaccine in development, it takes 10 years to really get that going.
That was before.
Right. Basically, these vaccines in less than 10% of the time were on the market. Now, the claim was, well, because of the technology, we can move so much faster. That's complete nonsense.
Mhm.
Because in China, with Sinovac and some of the other vaccines they have, and Russia as well, they're using traditional vaccines that were on the market faster than these RNA vaccines that we used in North America
Hmm.
and Europe. So that's complete nonsense. And I think Bernard Massé, he'd tell you that because he was working with the NRC. I should mention that Bernard and Dr. Provost,
Mhm.
they're members of the Scientific and Medical Advisory Committee of the Canadian COVID Care Alliance. These are
Mm.
the kind of people that we discuss these things.
Yeah.
We're very critical.
Mhm.
We want to make sure that we're right. We're not going to go out there and spread information that's wrong. Once you start to have information that you give that's wrong, you
Mhm.
completely lose your credibility.
Exactly. Yeah.
So we have to make
It's
sure it's bulletproof.
it's not in your best interest to do that. And you're going against a very strong narrative as well. So you want to make sure that you bring very strong evidence when you say something.
Exactly. You'd be
Mhm.
surprised at how few number of people are actually behind that narrative. But the way the system works, if you're a medical doctor, and let's say you wanted to prescribe ivermectin for treatment for a patient, or you had reservations about taking the vaccine, the colleges for physicians and surgeons, or for nurses and midwives, and even pharmacists, you are reprimanded if you discourage the use of these vaccines. You can lose your license. And there's many doctors in Canada that's exactly happened to them. And they've been reprimanded. So, and at the same time, there's a huge incentive, cash incentive, for doctors to give vaccines to their patients. They actually make a lot of money. In the United States, the average doctor make over $150,000 extra a
A
year
year.
if they got their patients to get vaccinated. So you have a very large carrot and you have a very large stick.
Hmm.
And so you can't be surprised that a lot of the people, especially doctors, they're not involved in the research. They're not, they see patients, they follow guidelines that are given, what they read in the scientific literature. Pretty much most of the literature that, it's peer reviewed journals, but there's a pressure in those journals to go and support the pharmaceutical companies because they're major advertisers in
Yeah.
those.
That's the big conflict of interest
There's
there.
a huge, huge conflict of interest. And of course, even the regulatory agencies, this is especially in the United States, you have like a revolving door between whether you're employed by the pharmaceutical industry or whether you're in a key position in
Mhm.
regulatory affairs, for government. And many of those people are going to be adverse to being too critical about the industry. And about in Canada and the United States, we're looking at about 70 to 80% of the costs of approval of a drug or a vaccine is paid for by the manufacturer. Now, we could say, well, look at all the money that we're saving, for the Canadian taxpayer or the US taxpayer, but you're putting your regulatory agency in where the hand that's feeding them,
Yeah,
you're not going to bite it.
of course.
So they're not going to necessarily act in the best interest of the general public. So this is a
Mhm.
problem. I think that I really do believe that our health professionals, our regulatory agencies, they're doing what they think is in the best interest of the public, but I think that they're misguided.
Mhm.
And there's a lot of pressure, especially political pressure,
Yeah.
to get these things done. And we're looking for these kind of solutions. And there's too much influence, conflict of interest from big pharma in this, unfortunately.
Well, you said earlier that some countries completely changed
That's right.
their way of doing. You even mentioned Australia. I was not aware of it. I know Australia refused Novak Djokovic. They went very far in
Well, yeah,
their.
so with New Zealand, and they've come completely 180 degrees now in New
So
Zealand.
that's possible. And I thought, Australia and Canada have a lot in common. So what will it take for things to change here in
Well, in
Canada, you think?
Switzerland, if you if a doctor wants the patient to get vaccinated for COVID-19, the government makes the doctor responsible if there's any injury. The
Uh-huh.
And they don't recommend vaccination for anybody.
But here they're not responsible, the doctors?
The well, the vaccine companies. This actually in the agreements that people be surprised by the agreements that are secret, but we know what the agreements are because it's the same agreement used in different countries.
Mm-hmm.
So the Canadian agreement, I'm sure, is very similar.
Mm.
What we do know is that the payment for the cost of these vaccines in the United States and in Europe was around $18 to $24, depending upon
Yeah.
now we know from the Auditor General's report in Canada that the average cost of a vaccine was $38 per shot. Now, the AstraZeneca and the Johnson & Johnson vaccines in these other countries is very cheap. We're talking about $5 to $6.
Mm-hmm.
So what that means is that Canadians paid for the Pfizer vaccines and the Moderna vaccines
Mm.
more than $38. So we probably paid the highest rates in the world. But in all of those agreements, there is there's immunity from prosecution of
Yeah.
vaccine injury to the manufacturers.
But what about the doctors, though? That's more my question because
In
some of
Canada,
them are
because
pushing it.
they have a protection from the standpoint that the government of Canada, Health Canada, has recommended them, so they can always point to that. They can point to the government. Now, the government has a program to help individuals that have been vaccine injured, but there's been very, very few people where they've been recognized as being vaccine injured.
I know a lot of people write to me and say, I know I have an injury due to the COVID injection, but my doctor won't sign the papers. He won't admit. He says sort of off the record, it's probably this, and then they have a lot of problem to get help. Like, they're stuck
Well,
with.
well, for example, the College of Physicians and Surgeons in Ontario basically took Patrick Phillips, who had filed, I think it was about 7 reports of vaccine injury, and he was basically his license was removed to be a
That's how
doctor
bad it is.
because they claimed his reports were not necessarily false, but that basically contacted the people afterwards that they should go and get vaccinated. Same is true for Charles Hoff in British Columbia. He filed 11 reports of injury, and he is now facing disciplinary action with the BC College of Physicians and Surgeons.
That's
These are kind of court
unbelievable.
cases I get involved in because it's
Yeah.
ridiculous.
It is ridiculous, and it takes a lot of courage to go against a narrative like those people are doing. And I wonder what it's going to take. Like, I don't want to say that I want people to go to prison, and I'm not mad, but
Mhm.
I want people to understand that these are dangerous. We know that. Stop injecting kids and pregnant women. First of all, there, to me, this is like the most important thing. And I don't know what's it gonna take for people to change their narrative. Like, we have a show in Quebec, it's called Tout le monde en parle, which is everybody, it's called, basically it means everybody talks about it. So it's very watched. And they had a pharmacist who has a TV show here this weekend, and he was talking about Dr. Montagnier, I'm sure you know Montagnier in France. He passed away during
Right,
the last years.
Nobel Prize winner.
Exactly, and he was against, the vaccine, if we can call them like that, and so they were just talking in a very bad way about this man, and they were, doing misinformation on CBC. That's the French part of it, is Radio Canada. And I was like, we're in 2024. We know for a fact that he was right. And there are so many things that were being said in this segment, and people were nodding and talking about those crazy conspiracy theorists. And they're still creating so much division. And I wonder what's it going to take to reopen the conversation.
Well, there's been national citizens inquiries that,
Hmm.
for example, Dr. Bernard Massé was one of the commissioners. He
Yeah,
wrote a very massive report. We had over 305 witnesses. 100 of them were
I
experts
was
in the
I was
field.
one of them,
Yeah,
and he
and,
too.
and the thing is, the truth eventually surfaces. Sometimes,
Hmm.
inconveniently late.
Yeah.
But we have two victims here. We have those that are unvaccinated that were unfairly treated, and then we have those that are vaccinated
Hmm.
that unfortunately will always wonder when they have an illness in the future, was that because I was vaccinated? And
Mm.
in many cases, it won't be. It'll be other things, but in some cases, it will be true. And we have a lot of people that have long COVID now. We don't know if that long COVID was, for example, exacerbated by being vaccinated. I
Hmm.
suspect that's the case. We seem to have more percentages of long COVID cases
Can you
after
tell us
vaccines.
what's the long COVID exactly?
Long COVID is where you have symptoms following infection with the SARS-CoV-2 virus that persists beyond a month. And in most cases, they're resolved in about 8 months.
Okay.
But there are some that go on beyond that. Usually, it's people that have an existing comorbidity,
Mhm.
some sort of disease, and by being infected or by being vaccinated, it exacerbates that condition. We signal out these individuals in the first place because we think that they're at greater risk of severe injury from the
Mm.
virus, but they're also at increased risk of severe injury from the vaccine too.
Mhm.
So it's very complicated. We know that some of these cases of long COVID seem to be treatable in part by inhibitors of the virus. So that could be ivermectin. Some people have data showing that that can be helpful. But there are medications like Paxlovid, which was developed specifically to stop the replication of the SARS-CoV-2 virus, and this can be partly effective in people with long COVID. So what that means is those individuals must still be having active virus in their systems that's contributing to their symptoms to
Mhm.
get that kind of relief from taking that antiviral. So
Mhm.
to me, that suggests that their immune systems are compromised so that the virus just keeps replicating at very low levels, enough to cause the illness in these individuals. So we probably have a wide spectrum of different explanations for why people are still ill
Yeah.
after, but um, it'll depend on the individual. When you get vaccinated and you're producing these lipid nanoparticles, you're taking these lipid nanoparticles and you're producing the spike protein. There's no control over the amount of spike protein that's going to be produced from one individual to another individual. It depends on their gender, their sex. Depends on their metabolic rate, their diet, their stress, all these different factors. So you can get these very dramatic differences from one person to another person on how much of that spike protein is actually produced and for how long it's being produced. And
Yeah.
then, of course, your previous exposures to either the virus or the vaccine can mean your inflammatory immune response to that will also be very dramatically different from person to person. So we get this situation where most people will become that get vaccinated will recover. They'll be perfectly fine. The vast majority of people, their body will heal. They'll get rid of those cells that are producing the spike protein with their immune systems to clean it out without any other assistance.
Mm-hmm.
But there will be a very small segment, maybe one in probably 200 or 300, that will be permanently affected, severely affected by these vaccines. That's the reason why this technology has to be better developed, better tested before we start giving it again to the general public.
Yeah, and it was massively administered. The very last question, she ends her article saying that unvaccinated people are more prone to die of complications from COVID. Is that true? What's the truth
No,
about that?
there's no scientific data to support that statement whatsoever. People have said, originally we were told that if you take these vaccines, you won't get infected and you won't transmit. That was completely false.
Mm-hmm.
No scientist is going to argue that someone who's been vaccinated isn't going to get COVID and spread it. I mean, 90% plus of the people in the last 2 years that have gotten COVID have been
We're
vaccinated.
vaccinated. Yeah.
So that's
So
so
what's
obvious,
the
right?
point at this point in
Right.
2024? Why would you get injected?
So here's the thing. We have a virus that's been mutating over time to become more infectious and more benign. That means less likely to make you sick.
Okay.
At the same time, we've had everybody pretty much has been infected with this virus, and they have some degree of an immune response. And for most people, they actually have a very strong, robust immune response that is long lasting. So there's no way that you can actually do a scientific study that can clearly show that the vaccine itself reduces the symptoms of COVID-19, because you've got a virus that's much more benign now, and you've got a population that's much more immune to it.
Mm-hmm. Mm-hmm.
So how would you know?
Right.
There's no way, there's no study that's been done
So
controlling for those variables
it's
that
just
you can say that.
it's just a myth basically that helps support those who really believe we're told that the vaccination would end this so-called pandemic.
That's right. And
Yeah.
I think the data, from what I can see, this whole program has extended the COVID-19 pandemic. It actually has probably endangered the health of our population. The response that we have is worse than the virus. I mean, if you were somebody who was, under 30 years of age, your chances of dying from this virus was about 1 in 100,000. And that would include people that have comorbidities like leukemia and all these other diseases. So young children, very much different from influenza, were very much protected from this disease. And the average age of someone in Canada that died from COVID-19 was 84. And the average life expectancy of someone in Canada from all diseases is 82.
Yeah.
So, you can't argue really that those individuals that died from COVID-19, and first of all, you can take the numbers that we have and divide them in half. So people dying with COVID, half those people went to the hospital not because they had COVID,
but they tested
they
positive.
tested positive with a test that's 90% inaccurate for false positives.
Yeah.
At the PCR, what we call thermal cycle number that was used.
Yeah.
So you can take those numbers and divide them in half. And then on top of that, what people died from wasn't the virus itself. It was more likely from pneumonia. And surprisingly, doctors held off from giving antibiotics that could have killed the pneumonia in those people that had COVID-19. And the intubation that they received actually increased the chances of getting pneumonia infections.
Why?
So we did a lot of mistakes early
Yeah.
on, and
But
that's what we found
tell
here.
me we were not doing this anymore.
No, no.
Okay.
Actually, it's very interesting. Canada went and purchased over 20,000 of these intubators that were never used.
Yeah.
And in terms of educating the general population, you know what? I think most people have figured it out by now. Because when you look at the number of times that people are now getting vaccinated, they're not taking the new vaccines. And the
No.
new vaccines are developed for variants that have already gone extinct and
Hmm.
replaced by other variants. Probably it doesn't really make much difference, but
Yeah.
the reality is that we threw away $1 billion worth of vaccines at the end of 2022.
Yeah. And there's so
So
much.
the public's figured it out. The health professionals are stepping up their messages for people to get vaccinated. And there's
Yeah.
a lot of articles that are coming out about how many lives were saved
Yeah.
because of the vaccine. If you take, Teresa Tam was one of the authors on this paper by Ogden et al., which was, published in Canadian Medical Journal, which basically had it's from essentially Health Canada. And
Hmm.
they argued that had they not had people vaccinated and the restrictions that they did, an extra 800,000 people would have died. Now, to put that in perspective, adjusting for the size of the populations at the time, that's more Canadian deaths from World War One, the Spanish 1918 influenza pandemic, and World War II put
Combined.
together.
Oh my gosh.
I mean, come on.
That's very far fetched.
And yet, everybody in Canada, we know from serological studies, have been infected. And
Yeah.
most of them were infected before the vaccines were even around.
And
So,
most of us didn't. Of course, it was bad. It was a flu, but
right.
it was not the end of the world. I know people who had to go to the hospital, but it's just a very very few, and it's part of life. And we've been saying that over and over. But when you want to live your life, you need to take risk. You go outside. You never know what's going to happen. But are you going to stay trapped in your house for the rest of your days just in case something might happen? At some point, I think the way we handled this was just way too extreme, and now we're facing the consequences, especially for the kids, have been very
Well,
strong.
I mean, you, you we've evolved over, hundreds of thousands, millions of years to, in fact, even a starfish has an
Mhm.
immune system,
Hmm.
and starfish have been on the planet for a billion years.
Hmm.
Okay. So our bodies are very well adapted to taking on, new viruses and bacteria and fungi. We're
Yeah.
surrounded. In fact, most people don't even realize that, you have 50 trillion cells in your body, but you also have about 40 or more trillion bacteria in your body. But you have about 300 um, trillion viruses in your body at all times.
Wow.
Most of them are benign. They actually, in
Mhm.
some cases, help you fight bacteria.
Hmm.
And the human body is adapted where if it's not a real threat, then it tolerates it. And
Mhm.
so there's a natural, well-developed immune responses that we have that will protect most people if they have proper diet, exercise, they don't have comorbidities, they'll be just fine. And when you restrict yourself, you isolate yourself, you don't go out, you don't get exposed to these things on a regular basis, then your immune system starts to get weaker and weaker. This is the problem for people that are in nursing homes and that don't go out, or individuals that don't go out.
Yeah.
You have to go out and
Hmm.
constantly get re-exposed to these environmental agents so
That's how
that
your immune system stays
your immune
strong.
system tuned up. Yeah, and,
Yeah.
and if you don't, then when this next thing comes along, you're actually going to be much more likely to get sick. So that's why we're seeing now, after some period of a few years of these restrictions,
Right.
more people getting influenza and
Hmm.
RSV, especially children, because they've never been exposed to it before.
Hmm.
So rather than doing what we thought about flattening the curve to to not overwhelm our hospitals, we actually now actually concentrate the curve
Yeah.
because we prevent people from actually being exposed to these things earlier on than they would when they're young children. Most children, about 95% of children get RSV before they're 2 years of age, and
Hmm.
there's very few deaths from RSV. So, this is a new RSV vaccine that's out there. It's
Why?
not really necessary, in part
Exactly.
because if they did get RSV and they had symptoms, there are drugs that are actually
Mhm.
available to treat them very
Yeah.
effectively. You don't have
Yeah.
to vaccinate your kid for it.
Yeah. Yeah. Thanks for everything that you just said. I was just listening and feeling a little sad because I remember in 2020, I was watching a video that was the first doctors. They were from California. I don't know if you've seen this video. His name was Dr. Erickson.
Mhm.
He's been deplatformed and I don't know what happened to him. It was one of the first, it was in March 2020. One of the first who was saying, listen, we have enough data to know it's not as dangerous as what
That's
they
right.
say. And he was already saying that it would be damageable for the kids, and that the collateral damages would be much worse. And now we are 4 years later, and that's what we observe. So I think what you just said is incredibly important, and thanks for doing what you're doing. I don't want to say goodbye right now. I want to take one question from the public. It's been in my comments for a while. Maybe you're not comfortable with this. I've had this question before. A lot of people in my comments are wondering what's going on with the vax shedding. What do you think about it? What do you know about it? Do you want to talk about it?
Yeah, well, when I had our clinical study with 4,500 people, at least a third of them I talked to directly on the phone about their situation. And many of them told me about this shedding phenomena, that they weren't vaccinated, but when they were with friends, sometimes they would feel ill, and then they would find that their friend was just vaccinated.
Hmm.
So we don't really understand the phenomenon. I think there's three possibilities here. One is that these people, as I mentioned earlier, if you've just been vaccinated and the virus is in the environment, you may in fact be more of a transmitter of the virus. So these people could be just being exposed to the actual virus and
Hmm.
getting a response. The lipid nanoparticles themselves travel throughout the body, and that includes going to the salivary glands. And so it's likely that there may be shedding of some of the lipid nanoparticles, although they would be very, very dilute in the environment that when it comes in, but that's a possibility. Then there's the spike protein itself. So when you have that inflammatory attack against the cells of your body that are producing the spike protein after the vaccine has gotten into those cells, uh, you generate these fragments of these cells. They're called exosomes, and so it's possible that it's actual little fragments about the size of a virus that are being released with a spike protein on them. And in people who have already had immunity, this may be triggering an immune response in those individuals that are breathing in the exosomes, we call them, that have the spike protein on them. I think in all of those scenarios, it's not particularly dangerous. I
Hmm.
think I think they're very dilute. The spike protein can't reproduce. The immune system will settle down. Uh, if anything, it'll give them a little bit of a boost for their immune system to stay
Hmm.
tuned up. So I don't think that there's really
Data.
well, I don't think there's a threat.
Right.
I
Right.
don't think there's any danger from
Hmm.
this.
That's the good
I think it
news.
is a phenomenon that seems to exist. Many people have,
Observed it.
sensed it and observed it, but I
Hmm.
don't think they need to be worried about it.
Good. Well, thanks for taking time today. Thanks for everyone that joined us live. Of course, this is still going to be online forever until it gets suppressed by YouTube or any other platform. But thanks for joining us today, guys, and stay safe. Thank you, Dr. Pelech.
Thank you very much, Eloise.